It's a life-saving effort for low birth weight babies and to help these very small, fragile patients overcome medical obstacles at neonatal intensive care units across the state. A human milk donor program was created in South Carolina. One of the donor sites, Spartanburg Medical Center.
It was after Aiden was born. He was born here at Spartanburg Regional, and I was actually speaking with my sister who works in the NICU and telling her about, I had a little bit of an oversupply and I wasn't really sure what I was going to do with it because I wasn't planning on going back to work. So I knew I wasn't going to need the milk. And she mentioned to me that South Carolina had recently started their own milk bank.
The Human Milk Donor Program distributes and pasteurizes milk for babies with low birth weights.
So they needed places across the state that would be donor sites. So we said we'd love to be a donor site, so we have since become a milk depot site where mothers can actually donate their breast milk to us that we then ship to the milk bank for processing and pasteurization. And then the hospitals around the state then purchase that milk to give to their neonates in the NICU.
I made my first donation in June, and I think at that point I donated about 28 pounds of breast milk that was frozen. So it's close to 3 gallons of milk.
The donor site at Spartanburg Medical Center is located at the Lactation Center, part of the Women and Children Services. All potential donors are rigorously screened by the milk bank, and all donated milk is tested. The milk helps low birth weight babies less than 3 pounds who face huge healthcare hurdles. What healthcare experts have found is that breast milk not only helps, but protects these babies from potentially life-threatening diseases
that have significant hurdles that they're going to have to overcome. And one of those huge hurdles that we're trying to overcome with our neonates, our premature neonates, is NEC, which is necrotizing enterocolitis. And that is a very, very serious disease that a third of the babies that develop that will die. A third will have long-term, even neurological defects going forward, and then a third will not. So you have a very high mortality and morbidity rate with that diagnosis.
Well, I've long believed that breast milk is wonderful for babies. It's so important that they get all those nutrients and stuff from the breast milk, and I'm happy that I was so able to provide that for some of these babies.
So far, the Milk Donor Program has been a success, but more donors are needed. If you are interested in becoming a milk donor, please visit the Mother's Milk Bank of South Carolina website at scmilkbank.org or call 843-792-5415.